Thank you for staying with us. 4 cabinet ministers in Zimbabwe are among the 962 people who died from COVID-19 in the country, with 3 of them passing away within a week of each other. President Emerson Mnangagwa has said that the country is facing a new war with coronavirus. Joining me for an update is Zimbabwean-based journalist Ngaba Machazi. Ngaba, thanks so much for speaking to us. 3 cabinet ministers within a space of a few days has got to be extremely worrying for the Zimbabwean government.
Yeah, definitely it is, but it's a symptom of what's happening in the economy, in the health sector. The health sector has faced chronic underfunding, and it was an accident waiting to happen. It only said that it has happened this way, and now that it's ministers that are affected, probably the government will have a real look into investing in health, because so far it's been a terrible underfunded. As you are aware, there's a Abuja agreement, which Zimbabwe is a signatory to, where it was agreed that 15% of the budget will go to health. Zimbabwe is barely doing 8 or 7%. So what's happening now is a symptom of a long-standing problem that has been affecting Zimbabwean health for a very long time.
Can you illustrate for us the state of the health sector in Zimbabwe?
I don't know if you are aware, Hugo, but a few years ago, 2 years ago, if I'm not mistaken, doctors went on strike, and there was a lady, one of the doctors, she cried when she was being interviewed, and she described the state of healthcare in Zimbabwe. She said people were just being brought in to die. And early last year, a picture circulated of 7 babies that had died when they were being given birth. So it's a picture of a health system that's already on its knees, and COVID-19 just came to sweep it away. Many people have gone to hospitals and not found any medical help or any sort. So what we're experiencing right now is a culmination of years of underfunding and lack of investment in the healthcare system. What makes it worse is because ministers and the rich people in Zimbabwe can come to places like South Africa, can go to Europe, can go to China for healthcare. So they didn't see it as a priority to invest in healthcare, and the public health system was left for the poor people who nobody really cared about, even if they died. So right now we are coming face to face with a collapse in the health system.
Now, you've suggested that the government needs to inject more money into the health sector. Does government actually have the money to do this?
Well, to be fair, I doubt there's much money to go about investing in healthcare. But there's so many other things that they're investing in which they could cut down there. I remember early last year, nurses went on strike when the health services board bosses were buying themselves very expensive cars, top of the range cars, when nurses didn't even have PPE. So it's just a matter of priorities. The money is not there, but if at least if the government is being sent to do something, rather than this, where they are being opulent, where they seem not to care about the people, this is what you get. If they could invest more, then our healthcare system will be better. I'm not saying COVID will not be as devastating as it is, but at least there will be something to go to. If you look at the stats in Zimbabwe right now, more people are dying at home than in hospitals because there's really nothing to go to in hospitals. And the few hospitals that are there, they are full to capacity.
Has the government attempted to engage corporate Zimbabwe and potentially Zimbabweans in the diaspora to assist?
I think what's happening right now, I thought there are a few corporate players that have come together to try and help the government. But all in all, I think we're relying on donors. Our healthcare system has been funded by UNICEF for the longest time, I think, in terms of at least giving people, nurses, an allowance of some sort so they could go to. So right now, some corporate players have come in, but it's piecemeal, it's ad hoc, and it's unstructured. And you can't rely on that. If it was a long-term plan, probably. But as it is, it looks like it's not sustainable.
Now, Zimbabwean President Emerson Mnangagwa made a public address yesterday to the Zimbabwean public. What was the context of this address, and is there a plan?
I'll start by answering your last question. There doesn't seem to be any plan. we were not told when, if ever there were any vaccines in the pipeline, who we were talking to. I think it was a wish list. It was more than anything substantive. We're not so sure. He says they are talking to some experts who are looking at the vaccines. We have no idea which experts they are, which countries we're talking to so that we have a vaccine. We have no idea how far we've gone with the COVAX system. A few days ago, one of the health minister officials said he was unaware of AU Afreximbank deal that was going to give us African countries some vaccine. So clearly there is no plan. What struck me most about the address was instead of telling us what's going to happen in terms of the vaccines, instead of giving us a timeline of when we can expect the first vaccines into the country, the president was emphasizing that the security services would be out in full force. Instead of dealing with it as a health pandemic, they are dealing with it as a security threat, which is giving out many people where you find police and the army out on the streets. While there is need for policing, I think more emphasis should be on getting the vaccine, or at least giving us a roadmap of when we're likely to get the vaccine.
But before we let you go, just give us some insight into the lockdown, what effect it's had, and obviously it ends in a few days. Do you see it being extended, and if so, what is the impact that it will have on the masses?
Yeah, with the upsurge in cases, they're going down now slightly. Deaths are still slightly high. I expect the lockdown to be extended. I'm not so sure for how long. But the problem with the Zimbabwean lockdown, I'm not speaking down about the country, but the problem with the lockdown is there doesn't seem to be a plan. It's a lockdown for the sake of a lockdown. You don't see any safety nets for the poor. You don't see any bailouts for companies. So companies are expected to just close. And in such a case, for example, in the poorer areas of centers like Harare and Bulawayo, there are people who survive on vending. And at some point, they are going to go back into the street and start selling because they have nothing to rely on. They need money for basic sustenance. And as long as the government is not providing anything and without a proper roadmap on what's really going on, you'll find more people are going to come back onto the streets, more people are going to get into town, and it's going to begin a process where the security sector and people who are desperate for at least to put something into their mouth are going to start clashing. And it's a harbinger for disaster, really, to put it that way.
But thank you so much for speaking to us. That was Zimbabwean-based journalist Nqaba Machazi painting a grim picture of how things stand in Zimbabwe.